Hello and welcome to another ConnectedMinds.ai podcast. Today I'll be talking about one of the most common sleep-related issues, insomnia. Insomnia is the difficulty in maintaining sleep or initiating it. It is a sleep complaint that is very common and may be persistent. You might have experienced difficulty sleeping and might have assumed it is to be a sleeping disorder or insomnia. Still, unless the disturbance in sleep is ongoing, it cannot be diagnosed as insomnia. A 1-year prevalence rate of 30 to 45% in adults is shown in population surveys. The symptoms also include frequent awakenings or problems returning to sleep and early morning awakening with the inability to return to sleep. Insomnia can be categorized based on how it affects sleep, such as sleep onset insomnia, sleep maintenance insomnia, or early morning awakening. Classification can also be made according to its duration, for example, transient, short-term, and long-term. It is a disorder that affects a person immensely. It is found that individuals with chronic insomnia have more than twice as many vehicle accidents compared to the general population. Only 5% of the people with chronic insomnia seek professional help, while 40% of them self-medicate with over-the-top drugs, alcohol, or both. The different treatment strategies are mentioned and explained briefly in this podcast so that you or your dear ones suffering from this condition can seek help and stay aware of it. Cognitive behavioral therapy. As a therapeutic approach, cognitive behavioral therapy, CBT, combines behavioral and cognitive techniques to help you overcome your dysfunctional sleep patterns, misperceptions, and distorted, disturbing sleep thoughts. Universal sleep hygiene, stimulus-controlled therapy, sleep restriction therapy, relaxation therapies, and biofeedback are some of the behavioral techniques. CBT has been shown in studies to improve sleep symptoms such as the number and duration of awakenings and sleep latency. CBT benefits are similar to those of medicine in the short term, but they endure for up to 36 months after treatment. When a medication is stopped, insomnia often returns, sometimes accompanied by rebound insomnia. CBT has not been proved to have any negative consequences. Universal sleep hygiene. Universal sleep hygiene focuses on changeable environmental and lifestyle factors that can disrupt sleep, as well as activities that can help you sleep better. One of the 3 problem areas would be treated at a time. Because some of these behaviors are difficult to modify, only 1 or 2 items that you and the clinician choose together should be addressed. This increases your chances of a successful intervention. Trying to overwhelm you with too many lifestyle changes or a complicated routine rarely works. Some general do's and don'ts can be helpful. A few easy changes in your sleeping habits or environment can help. However, the clinician must spend time reviewing both your routine and its irregularities. In some ways, the unpredictability of insomnia is its core. The causes causing the problem can be obscured by day-to-day changes in your behavior and the intensity of sleeplessness. Stimulus control therapy. This treatment is designed to stop your cycle of issues typically connected with difficulty falling asleep. Stimulus control therapy reduces both primary and reactive components in insomnia by seeking to reverse conditioning that interferes with your sleep. The guidelines aim to improve sleeping sensory cues while reducing sleeplessness associations. The directions are straightforward, but you must follow them regularly. The first rule is to go to bed only when you're tired to maximize success. Second, the bed should only be used for sleeping. Do not watch television in bed, read in bed, dine in bed, or talk on the phone while in bed. Third, if you can't sleep, don't lie in bed and get frustrated. Instead, get up, walk to another room, and do something non-arousing until sleeplessness returns after a few minutes. Do not check the clock. The idea is to make the bed synonymous with falling asleep quickly. Rule 3 should be spoken as many times as necessary. The fourth and final instruction is to improve the mechanisms that underpin the circadian and sleep-wake cycles by waking at the same time every morning, independent of bedtime, total sleep time, or day of the week, and avoiding napping altogether. Stimulus control therapy is effective, however, improvements may not appear for several weeks or months. Insomnia attacks become less frequent and less severe if you practice regularly. Cognitive training. This proven treatment for a range of mental disorders, including major depression and generalized anxiety, has been developed for use with insomnia. The cognitive part of insomnia treatment focuses on the unpleasant emotional response to a sleep-related scenario appraisal. Emotional arousal is assumed to be produced by the undesirable emotional response, which contributes to or prolongs sleeplessness. If you have maladaptive cognitions that exaggerate the negative implications of insomnia, such as, "There must be something seriously wrong with me if I can't fall asleep in 40 minutes," you also have unreasonable expectations about how much sleep you need. "If I don't get 8 hours of sleep every night, my entire day would be ruined." The first move is to identify these distorted cognitions and challenge their validity. They are substituted with more adaptive cognitions. Paradoxical intention. This is a cognitive approach with mixed data on its effectiveness. Compliance is frequently a hurdle in clinical practice, but it does work for a small number of patients. The theory is that performance anxiety might prevent you from falling asleep. As a result, performance anxiety is lessened, and sleep latency improves when you strive to stay up as long as possible rather than falling asleep. This teaches you to deal with your sleeping problems more upfront or directly. By staying awake instead of falling asleep, you are exposing yourself to the situation to gain a deeper understanding of it. This technique has helped a lot of people. Other pharmacological treatments, benzodiazepines, zolpidem, esoplaclone, Lunesta, Zaleplon, Sonata, and other hypnotics are routinely used to treat primary insomnia. Hypnotic medications must be used with caution. In general, sleep medicines should not be used for more than 2 weeks due to the risk of tolerance and withdrawal. However, these drugs should be prescribed by a doctor, and you must not use them on your own.